Okay, I am teaching today on understanding health insurance, which is part of our life skills training. And I have 3 people in my audience. I'm going to turn around my camera so you all can see Becca, Lindsay, and Stephanie. So, okay. How many of you all watch Friends? All of you? I'm surprised because that was like the big sitcom when I was your age, and now you all are all watching it. So we're going to start with this little clip of Joey losing his health insurance.
Hey, any good mail? Yes, you got something from the Screen Actors Guild. Ooh, probably residual checking. Can you open it for me? Benefits lapsed. That's weird. I don't remember being in a movie called Benefits Lapsed. It's not a check. They're saying your health insurance expired because you didn't work it out last year. See that? Oh, I can't believe this. This sucks. If I had insurance, I could get hit by a bus or catch on fire. You know? It wouldn't matter. Now I gotta be careful. I'm sorry, man. There's never a good time to have to stop catching on fire. All right, well, so I'm gonna go get a job. I'm gonna go see my agent. Hey, make sure to look both ways before you cross the street.
Okay, so there's that. How many of you all have heard about insurance, health insurance? Do you hear your mom and dad talk about it?
Yeah.
All right, have any of you all started thinking about insurance?
Yes. Yeah.
You have? Good.
No.
No, you're not thinking about it at all. All right. The population in America is aging and they require more health care services. And the Affordable Care Act now requires that all Americans have health insurance. So you may already know some things about the topic, and I'm going to ask you some questions and you all can add to our discussion. Let me put, what do you already know about health insurance? Put my flip chart up there. All right. What do any of you all have any personal experiences with health insurance as a health insurance consumer? Have any of you broken your arm?
I've had 3 knee surgeries.
You had 3 knee surgeries because you're in gymnastics.
Yes.
Yes. All right. So, did your parents use your health insurance?
They did.
They have, your dad works at Toyota, so he probably has a good policy. All right. Did you make any personal observations while you received any health care services? Do you all think people who have good health insurance are treated better than those who don't have health insurance?
They shouldn't be, but probably. Yeah.
Right. Okay. What have you heard or read about health insurance?
It's too expensive.
It's expensive.
You have co-pays.
You have co-pays. All right. Becca, do you have anything?
She took mine.
She took yours? Okay. All right. So definitely expensive. Oh, co-pays. What else can you all think of?
Network.
A network? Yeah. You have to have a doctor who is in network. And we're going to learn about all of these things. So some of you all have some experience with health insurance and some of you don't. So hopefully you're going to learn some more from me. We are going to watch. Oh, is there anything that you all, let me back up. Can you all think of television shows, movies, or advertisements that relate to health insurance? Do you all see any ads come on TV?
Commercials. Commercials. Yeah.
Commercials, which ones have you thought of? I think Humana
Yeah.
has some.
United.
United, Aetna, right? Okay, so
The Jonas Brothers.
those,
Commercial.
the Jonas Brothers
Yeah.
does a commercial. All right. And what questions do you have? And is there anything that you all hope to learn about health insurance?
Where is a good place to find out what is covered by your insurance?
Okay, all right. Well, we're going to talk about some of that. So, all right, the next thing I'm going to show you all, let me move my flip chart. And we're going to watch this video that explains health insurance. Let me make sure I have the right one. Yes.
Millions of us now have health insurance under the Affordable Care Act, or what some people call Obamacare. But like many things in life, your health insurance can often be confusing and complicated. Whether you've been insured for years or you're new to the game, understanding your policy is important to your health and your wallet. First things first, you have to pay your premium every month or your insurance could get canceled, kind of like your cable subscription. You can also think of it like a shared healthcare piggy bank. We all chip in each month, even if we're healthy, so the money is there when we need it. If you get insurance at work, your employer probably pays most of your premium, and the rest comes out of your paycheck automatically. If you have Medicaid, you most likely don't have to pay any premium at all. The federal government and your state take care of that. If you're insured through a new health insurance marketplace, depending on your income, you may be eligible for a tax credit that pays a portion of your premium. Once you have that shiny new insurance card, you'll want to try really hard to keep it in your wallet. To better your odds of staying healthy, be sure to take advantage of the free preventive services that all new insurance plans provide. But of course, stuff happens, and that's when insurance really comes in handy. Now, having insurance helps a lot, but it doesn't mean all your health care is going to be free. There are lots of details about your insurance plan that affect how much you pay when you get sick or injured. If you have Medicaid, a lot of these services could very well be free. Otherwise, you'll likely have to pay something when you go to the doctor or fill a prescription. This is called a copay when it's a specific dollar amount, like $25 per visit, or co-insurance if it's a percentage of the bill. There's also the deductible. That's how much comes out of your own pocket before your insurance starts paying. Depending on your plan, you might have a deductible for all your care, or it might only apply to some types of care, like hospital stays and prescriptions. So read your plan material, because it can add up to thousands of dollars. Another important part of your plan is the out-of-pocket maximum. This is the most you'll ever have to pay in any 1 year, at least for the benefits your plan covers. Your insurer will pay 100% of anything beyond the maximum for the rest of the year. It can be just as confusing dealing with prescriptions. Your plan is a list of drugs it will pay for, called a formulary, but the prices vary. Check with your doctor or pharmacist, because a generic drug might fix you up the same as a brand name drug, but the price difference could be huge. So those are the costs typically involved. But remember that they'll be affected by your insurance plan's provider network. This is a list of doctors and hospitals that are connected to your plan. Insurance companies negotiate discounts with these providers. Stay in network and the discounts get passed to you. Go out of network and you could end up paying full price. And remember that out-of-pocket limit? It won't work if you go out of network. In some plans, like HMOs or EPOs, your insurance would pay nothing if you go out of network. In other plans, like PPOs, your insurance will cover you no matter where you go, but you'll pay a lot more if you go out of network. Also, if you want to visit a specialist like an orthopedist, some plans require a referral from care doctor. Sound easy enough? Well, sometimes staying in network can be tricky. In a hospital, it's possible that your surgeon could be in network while your anesthesiologist is not. If this happens to you, don't be afraid to negotiate with your provider or file an appeal with your insurer. So as you can see, there's a lot to think about when you choose an insurance plan each year. Some plans may have low premiums, but fewer doctors or hospitals and high deductibles. There are trade-offs, and understanding and choosing among plans isn't always easy. Remember, if you have questions, call your health plan and ask, or check with your hospital or doctor. If you still have questions, your state insurance department or consumer assistance program can help. With the Affordable Care Act, there's new support for consumers, so take advantage of it. Having health insurance protection is a good thing, especially when you know how it works. We hope you're now better prepared for the next time you have to pull that insurance card out of your wallet. Stay safe, America.
All right, now I'm going to see how well you all were paying attention. I have a few questions. There are different sources for health insurance. There's employer-sponsored, you have employer-sponsored plans, there's Medicaid, and the health insurance marketplace. Who pays the premium for each of these? In an employer-sponsored plan, who pays the premium?
Employer pays part of it, and then part of it is deducted out of your paycheck.
Yes, correct. Your employer pays part, and the other part is paid for you by you out of your paycheck. What about Medicaid? People who get Medicaid, who pays for that?
The government?
The government. And what is where does the government get their money?
Taxes.
From taxes that we also pay out of our paycheck. And the health insurance marketplace, who pays for that?
You do.
Mm-hmm. Yeah, the government subsidizes, but then depending on your income, then then you also pay for part of it. Who can tell me what the difference is between a copay and co-insurance?
With a copay, you pay a set amount every time you go to the doctor. With co-insurance, you pay a percentage of the bill every time you go to the doctor.
Right, good. And what about a deductible and the out-of-pocket maximum? Why is it important to pay attention to these costs of your health insurance? It's kind of a trick question.
Because that's what you'll be paying.
Yeah, that's what you'll be paying out of your pocket. So the deductible is the amount that you pay before your insurance starts to pay. And then the out-of-pocket maximum is the total that you have to pay, which is your deductible plus your percentage. And then it maxes out, and then your insurance company starts paying the whole 100%. So you have to be able to do some math when you have health insurance to figure out what part you're going to be paying. A list of drugs your insurance will pay for is called what? Do you all remember that? Yes, a formulary. Good. And what is a provider network?
The group of like doctors and providers that partner with your insurance.
Right. Good. And does the out-of-pocket maximum apply if you see a doctor who is out of network?
No.
No. Good. In which of the following plans will your insurance likely pay nothing if you go out of network? A PPO or an HMO? If you go out of network, an HMO would not pay any of the bills from your doctor. Okay, we're going to talk about premiums for a minute. We learned the basics of how insurance works, and the risk of incurring major expenses for medical treatment is spread across a large group of people that pay for the losses of a small percentage of people who need the health care policy. So everybody pays, all of the policyholders pay a little bit of money into, well, actually, it's a whole lot of money, but that's because health insurance is so expensive. Or health care is so expensive. So healthy people pay for the expenses of those who need medical treatment. So if someone is injured, if somebody has cancer, if someone gets pregnant, then it's all the healthy people at that time that is paying the money so that their bills can be paid. And then hopefully they will get well and continue paying their premiums so that the other people, it kind of, you take turns. Premiums are usually paid monthly or quarterly, and they are typically deducted from your paycheck. And benefits is the next word we're going to talk about. Having health insurance reduces the risk of incurring a large medical debt. Instead of having to pay tens of thousands of dollars in your medical expenses, your out-of-pocket expenses are limited to the deductible and whatever the co-payments, the co-insurance, and the out-of-pocket maximum. The deductible, that's a term that is used to describe the amount of money that you must pay for health care services before the insurance benefits begin to pay, or yes. Until the annual deductible is paid, no health insurance benefits are paid. So if you have a really high deductible, let's say you have $1,000 deductible, if you go to the doctor 6 times, you're probably still not going to reach your deductible. So you would be paying your monthly premium plus that high deductible. But sometimes the premium for that is cheaper than if you have a lower deductible. So it all gets, like I said, it's all a big math game trying to figure out. A lot of it too depends on how much you have accessible. So it may be easier for you to pay a higher premium every month because you've not had an opportunity to save up a lot of money. And so especially for young people, it may be easier to come up with a higher premium every month out of your paycheck than it is to empty out your savings to meet that large deductible. So you have to weigh the pros and cons. The reason, everybody is going to have to meet some kind of deductible. There's going to be co-pays. Basically, anytime you get sick, that's money that you probably haven't considered as part of your budget. So that's why it's always a good idea to have an emergency fund set aside that is equal to 3 to 6 months of your living expenses, so that if you have these extra expenses, you can have that. And we talk about that in one of our other classes about budgeting. So the relationship between deductible and premium, generally speaking, when the deductible increases from $500 to $1,000, then your premiums decrease. And that's because policyholders with a higher deductible are assuming more risk of loss, and their policies are priced accordingly. Increasingly common are health insurance plans that are provided by an employer. They're offering a higher deductible policy with very large 4-figure deductibles. I'm going to share a story about a high deductible. It has to do with car insurance, but deductibles and insurance work the same way. My daughter was in a vehicle accident, and a deer ran out in front of her. And typically you have an insurance where if something like that happens, it's called an act of God, and that would be covered. But for some reason that wasn't covered in hers, and she had a $1,000 deductible. And it was really, she's in college and works part-time, and it was really hard for her. She didn't realize that she had such a high deductible under her dad's policy. And so she had to come up with the $1,000 plus the deductible to get that done. And she wasn't expecting that. And luckily she did have some savings, but now she has a lot less than what she had saved for. And she had plans for that, and instead she had to pay to get her car fixed. So I'm going to pause this recording for a minute because I have a crossword puzzle for you all to complete. I'm going to show it on, let's see there. It has several questions on it, and I'm going to hand that out and let everybody work on it really quickly. Okay, I will check all of these a little bit later, but let's go over a few of the questions. Any cost that is paid by the consumer as opposed to by the insurer. It's 3 words. Does anybody know what that one is? It's 6 across.
Out of pocket.
Out of pocket, good. And the cost of the contract or the policy is 11 across.
Premium.
Premium. And let's do 2 down. This one wasn't in here, but I thought you all may have heard your parents talk about it. This is the age which the law requires a child or a dependent be covered under a family policy regardless of whether they are a student or married. Does anybody know what that age cutoff is?
26.
26, good. And if you want your insurance company to pay, you have to file a blank claim. All right, sounds like you all did good on that. Okay, next. We are going to watch another short video. This one is Understanding Health Insurance Cost. And it's going to explain the cost of health insurance, and you're going to learn more about premiums, deductibles, and out-of-pocket maximums. Afterwards, we're going to discuss and work through some of the math problems to help you determine the cost of various plans in different situations.
You're deciding which insurance plan to purchase and want to know how much is it going to cost. Well, it's not so simple. Sometimes you pay money toward your health care. Sometimes the insurance company pays money. But when? To figure it all out, there are 3 main ideas you need to know: premiums, deductibles, and out-of-pocket maximum. It may sound complicated, but stay with us. It's not as hard to understand as you think. First, premiums. Think of your insurance as a monthly membership. Every month you pay the same amount in order to be a member. That amount is your premium. With your premium, say $200 a month, you get some preventive care for free. This includes care like vaccines and screening for diabetes, cholesterol, and breast cancer. This care is covered by your premium. But what if you need more than just preventive care? If you need a health service beyond preventive care, illnesses, a broken leg, emergency room visits, you usually need to pay extra. How much? Well, that changes over time. There are 3 main stages. First, you pay. Then, your insurance pays some, and you pay some. And finally, your insurance pays everything. So how does this work? In the first stage, at the beginning of the year, you pay for most of your health care until you reach your deductible. Remember that word? Deductible. A deductible is the amount of money you have to pay for your care before the insurance company will share the costs. So let's say your deductible is $500. That means almost every time you get health services, you will pay for all those services until you've paid a total of $500. It's like you're filling up a bucket. Once you add enough to that bucket so that you pay your whole deductible, then everything changes. Then you enter into the second stage. Now every time you get health services, your insurance company will share the cost of those services. How much? That depends on your plan. Usually, you pay part of the cost, fees called copays or coinsurance, and your insurance pays the rest. But the second stage doesn't go on forever. If you reach a certain amount, you won't have to pay for any services. Remember that bucket? Every time you fill it with copays and coinsurance, your insurance company is keeping track. If you fill that bucket up to the top, everything changes again. You enter stage 3. From this point on, your insurance company pays everything for the rest of the year. That's right, every dollar of your health services paid by your insurance company. So what's at the top of that bucket? It's called your out-of-pocket maximum. This is the most money you will pay for your health care over an entire year. So let's say your out-of-pocket maximum is $2,000. After you pay your $500 deductible, and if you pay an additional $1,500 for various health services, you've hit your out-of-pocket maximum. From then on, you don't pay a penny more for covered healthcare services. It's important to note that every year, this starts over. So next year, you go back to stage 1 and need to meet your deductible yet again. So let's review. You pay a monthly premium to get into the club and get many preventive services free. You pay for other services until you meet your deductible. Then, you and your insurance company share the cost of health services. You pay co-pays or co-insurance, and your insurance pays the rest until you hit your out-of-pocket maximum. After that, your insurance company pays everything. So, how much does your insurance cost? You will at least pay for your monthly premiums, and at most, you will pay for your monthly premiums plus your out-of-pocket maximum. It all depends on the plan you choose and the care that you and your family need. You can get free help from a healthcare.gov assister to choose the plan that's right for your family.
Okay. All right. All right, we're going to think through this for a minute. If you have an unpaid $1,000 annual deductible and an $800 medical bill, how much will the insurance company pay?
Zero.
Very good. That was a trick question and you all have caught on. All right, we're going to work through some math problems together to better understand what your costs will be under different circumstances. So let's say I've written here on this flip chart, your deductible is $500, your co-insurance is $80.20, and your out-of-pocket maximum is $5,000. Let me give you all paper, not the answer sheet. We'll pass those around. Just turn it on the back right now, and so you have an insurance plan with a $500 deductible, an 80/20 co-insurance, which means you pay 20% and the insurance company is going to pay 80%. Your out-of-pocket maximum for the year is $5,000. Now let's say you go to the hospital and you incur $7,500 worth of medical bills. How much do you have to pay out of pocket? Okay, we're going to start by subtracting $7,500. This is hard. My person that was supposed to help me is not, my volunteer did not show up. So, all right, $7,500 minus the deductible. That leaves us how much? $7,000. Okay. And then remember, you have to pay the deductible before the insurance kicks in. And then you have to pay 20% of the $7,000 that is left over. So what is 20% of $7,000? You all can use your calculators if you need to.
1,400.
Yes, $1,400. So, $1,400. So all in all, we're going to have to pay $500 plus $1,400. And that is a total of $1,900 out of pocket. And you will have to continue paying out of pocket until you reach how much? $5,000, right. That's our maximum. Now, at that point, you will no longer pay any more co-insurance until when?
Next year.
Right, January 1st of the next year. What would your out-of-pocket cost for $20,000 of annual medical expenses be? If you have $20,000 and you pay a $500 deductible, that leaves $19,500, and 20% of that total is whoa, 3,900. So what would you add together to find out?
3,900 and 500.
Okay, and that equals 4,400. Have you met your out-of-pocket maximum yet? No, correct. Now, one more. What would be your out-of-pocket cost for $40,000 of annual medical expenses? 40,000 minus 500 leaves 39,500, and 20% of that amount is
7,900.
right, and the total is
You pay 5,000.
you would pay 5,000 because the 3,400 that is over that, who's going to pay that for you?
Insurance.
Your insurance company, right. Okay, so I've handed you all a health insurance math worksheet, and I'm gonna have you all can work together to discuss the questions and work the math, and then we will review the answers. And remember that premiums do not count toward the out-of-pocket maximum. Also, I want to remind you that the out-of-pocket maximum and the deductible starts over at the beginning of the plan year, and that's usually January 1st. So that's why a lot of people will schedule surgeries either at the end of the year if they've already met their deductible, or if they haven't met their deductible, they'll try to put it off until the beginning of the next year, so that if they have to have their other family members need stuff and they need something, they can just meet the deductible at the beginning of the next year. So, all right, we're gonna pause while you all work your math problems. Okay, here is the health insurance math that I had them do. It has some problems on it similar to what we did. And we've gone over those, and they did extremely well. The next thing, currently, just a few more things I want to talk about, and then we're going to play a little game. Currently, if you are under the age of 26, you have the option of staying on your parents' health insurance plan. Or as you've seen in previous resources, it's typically a great idea to enroll in an employer-sponsored plan if it's offered. But a lot of times you all will learn as teenagers and young adults, it may just be a job that you're not planning to stay at, and your parents, if they work for a big corporation or the federal government, they may have a better plan than you could get on your own. So definitely you would want to decide whether to stay on your parents' plan or to go on your own plan. And then when you get married, it would be the same thing. You could stay on your parents' plan until you're 26, or you could go on your spouse's plan. And so it would be important to look at these things, to compare your plan with your parents' plan to decide which would be the best for you. Now, if this is not an option to go on an employer-sponsored plan, or once you turn 26 and you have to have your own plan, you can also get a plan through Marketplace, and that you go to www.healthcare.gov. And currently, if we went to that, and let me open that up real quick. Healthcare.gov. Okay, it says the 2019 open enrollment. Well, here's a pop-up. If you're looking for 2019 coverage, start here. Open enrollment is over, but you may be able to get covered through Medicaid or CHIP or Marketplace. Sign up to receive important notifications from the Marketplace. CHIP is for Child Health Insurance Program. Medicaid is for people with disabilities. And Marketplace, of course, is what we've been talking about. That's the government-sponsored plans. But it says 2019 open enrollment is over. Do you still need health insurance? And then you can see if you can enroll or see if you can change. And so those are the options there. Currently, open enrollment is closed for the year. It reopens on November the 1st for coverage beginning January 1st of next year. So, all right, we are going to play a game. Hanging around the room, a few of them have fallen off, but there's one behind me. It has a door. It says employer-based coverage. That one over there, Becca, do you care to pick it up and see? And Lindsay, will you get that one that fell down? Okay, you want to open that door up? I'll just give all of you all jobs to do. Okay, there are 5 different doors. One says parent guardian coverage. That's back on the back wall. Employer-based coverage is behind me, the one on my door. Marketplace or Affordable Care Act coverage is over on that wall. Medicaid is on the back door. And then no insurance, meaning that you pay for all of the medical costs out of pocket. That one is up there. So I'm going to read a scenario and you all go stand by the door. That would be the most appropriate. Okay. You are 19 years old, you go to college, and your parents have a plan through Blue Cross and Blue Shield. Yay, whoa. They all went to stand by the parent or guardian coverage. So that would be the best option to stay there. You have graduated high school and have a job paying minimum wage. Your parents have a plan through Humana. You're going to stay there. Good. All right. Parent or guardian coverage. Okay. You are married and your husband works for Toyota and has his own plan. You are 24 years old. Which door? And there may be a different option.
This is employer-based coverage.
Okay. Lindsay's decided she's going to stay on her mom and dad's plan
Make them pay for it.
and make them pay for it. And Stephanie and Becca are going to go on their husband's plan at Toyota. So, and either one of those would be an option for you. I would suggest that you compare the two. All of my signs are falling down. I would suggest that you all compare the two to see which one would be best. You're 27 years old and have a low-wage job. Which door? So if you're 27, you can't be on your parents anymore. You are able to work. Some of our doors have fallen down. What does that one say over there?
Marketplace.
Yeah.
Just
So
that it's what type of job?
a low-wage job. They're thinking. I would say your best option would be the Affordable Care Act Marketplace, because if it's a low-wage job, more than likely you're not going to have to pay anything for your insurance, or if you do, it's going to be very low. The other thing would be going without insurance, but then you may have to pay a penalty for not having insurance. Okay, you are severely injured. You have severely injured your back in a car accident and are unable to work. You have been declared disabled. Which door? Very good. They all went to the Medicaid coverage door. You want to live on the edge and save your monthly premium. You think, I'm 26 years old. I'll never get cancer. I'll never have an accident. I don't get sick. I don't ever get the flu. Which door are you living by?
No insurance.
The no insurance. Yeah. Do you all think that's a good plan?
No.
Maybe, maybe not. Roll the dice. Probably not.
Without some risk.
Right. Okay, you're 23 years old and you're in college. Your dad is deceased and your mom draws disability. Which door? I think your choices would either be, both of you all could be insured. Well, actually, I think you can still be covered under Medicaid with her, but I'm not positive. I think you would have to get a marketplace. I think those are your options. You have a couple different options. So, all right. Well, I hope you all have learned some things about insurance that you didn't know when you first walked in the door. And I'm going to ask you to complete this health insurance quiz to see what you've learned today. And when you get done with that, there are some other resources and links. I'm going to hand you all a worksheet that has some other links and, well, for extended learning. And that's to go to healthcare.gov. There's a blog about where you can search different topics. Health Insurance 101, the basics, that's another YouTube video. And then Understanding Health Insurance, that's the same one that we watched earlier today. So I thought it was pretty good. So anyway, once you all take this quiz, you can hand it back to me, and then we will be, you are free to go. And I really appreciate all of you all coming out tonight. Thanks.